Hello, everyone. This is Dr. Valerie Mukanga with Healing Wings Dental. And today, for optimizing your life, I have a very, very great guest. And she's going to dive into the subject, Sickle Cell Anemia 101. She is a hematologist, but I'm going to let her introduce herself because I don't want to not do her justice in my mere introduction. So I'm going to let her introduce herself. Dr. Toyosi Onwuemene, would you please introduce yourself?
Dr. Makanga, thank you so much for having me on the show. For
Absolutely.
your audience, I am Dr. Toyosi Onwuemene. I am a hematologist and an associate professor of medicine at Deakin University Medical Center. As a hematologist, I take care of patients with blood diseases, including sickle cell disease. So I am so excited to be here because I think when people are educated, then they do better. So I'm happy to be here. Thank you for having me.
Wonderful, wonderful. So we're going to dive in because I have so many questions and I'm sure I'm not going to be able to exhaust the subject today. But please, Dr. Toyosi, would you please let me know and let our audience know what is sickle cell anemia?
What a great question. Sickle cell anemia actually represents a collection of diseases, and it's all one, but a collection of disorders that have the primary problem of a sickled red blood cell. What does that mean? When we think about the blood cell in our bodies that are most important for delivering oxygen, it's the red blood cell. The red blood cell helps to give our blood that beautiful red color that we see whenever we, for whatever reason, have bleeding or get our blood drawn. And so red cells are really important because they deliver oxygen to the tissues. So red cells have to be able to be very flexible to be able to deliver oxygen because they squeeze through the tiniest blood vessels to deliver oxygen. Well, when sickle cell disease happens, there is a mutation in one of the important proteins in the sickle cell membrane that helps to make it flexible. So the red cell goes from a normal, flexible red blood cell to a very rigid and inflexible red blood cell. What does that mean? When it's time to deliver oxygen and squeeze through those tiny blood vessels, this red blood cell is too strong. It's too rigid. It breaks and it blocks the way. So not only does the red blood cell not deliver the oxygen it's supposed to deliver, it's blocking the way. And so the flow of nutrients is impaired. The flow of oxygen is impaired. For that reason, the tissue starts to die. So when you think about sickle cell, one of the most important problems associated with sickle cell is pain. And that is the pain of tissue that is dying because it doesn't have oxygen. So it is a very important disorder. It affects about 100,000 Americans, and globally it affects millions of people. And it's a very important disorder because it really impacts people negatively.
Oh, that's really sad. I'm actually very keen to this disease because I have a few members of my family that did suffer from it. When I say did, I mean have suffered from it, but I say did as well because one of my mother's sister actually had sickle cell anemia all her life, and she actually passed from it with a crisis. She was always in pain, as you described that, one of the consequences of it is the pain when the cells are so rigid. She was always, suffering from that. So let me ask you this though. Is there, I think, I know, or I've heard that, it's kind of like ethnicity, maybe not specific, but it affects some ethnicity more than others. Am I right about saying that?
Yes, Dr. Makanga, first of all, I'm sorry to hear about your aunt. And I think one of the things you highlight is that sickle cell disease is personal to many of us because we have family members, friends who are affected. And so it's a disease that we're familiar with because we have firsthand experience in our relatives. And so thank you for sharing that. I would say that one of the things that's really important to know about sickle cell is that it's a genetic disorder. That means it's acquired genetically. And it's important to know that, because even though sickle cell first came about as a response, it could be, when you think about protective genetic changes, it's considered a protective genetic change in the trait form because it has malarial resistance, right? Sickle cell trait is malarial resistant. And when you think about areas where malaria is endemic, and so that's thinking about sub-Saharan Africa, thinking about the Mediterranean, that's where you tend to find sickle cell disease. So in general, it does tend to cluster in people who are of African descent. However, sickle cell disease is not limited to people of African descent because it's genetic. And so, yes, we do have Caucasians, we have people from the Middle East, we have African Americans, we have Indians. People can have sickle cell from whatever race and ethnicity is possible because it's genetic. In general, though, it has primarily affected people who are of African descent and in those who are part of the malarial belt due to the kind of the protective nature of trait from malaria.
Wow. Wow. That's something that I wasn't fully aware of. I didn't know that even Caucasian were affected by sickle cell disease. But as you say, it's genetic. So basically, if you're married into it, it can end up being in your genes.
Yes, and so
Wow.
although numbers are not high, we definitely can see it, and that's important because I think as providers are caring for patients,
Right.
it's important if you're concerned about it, and this is why sickle cell screening is, at least in the United States, it's a national universal screening because anybody can be affected.
So tell me, you just mentioned screening. Why is screening important?
Oh my goodness. Thank you so much for asking that question. Screening is important because the devastating effects of sickle cell can start very early. So when children are first born, they have maternal, they have fetal hemoglobin that is actually, that's somewhat protective from the effects of sickle cell. And that lasts for about 6 months. So when children start to experience the effects of sickle cell, usually they're about 6 months old. And it's hard to say exactly what's going on for these children because they can't tell you what's wrong. But what's important is that the earlier we can diagnose sickle cell and treat, the fewer the complications. So remember I told you that sickle cell is a problem of red blood cells that are rigid and they block
Right.
the way and they cause what we call tissue ischemia. That's oxygen is not flowing to the
Right.
tissues. And so the long-term effects of that is really dysfunction of organs, damage to organs. So, lungs not working like they should, the heart not working like it should. There's a whole host of consequences. So the earlier we can identify sickle cell and start to address these consequences, one of those consequences is damage to the spleen. And the spleen is so important in protection from infection. So early on, children are at a high risk for significant infections. And so knowing it early, making the diagnosis early, putting children on medications that help to prevent the effects of the disease and also preventing and protecting them from infection. Those are really important. And that's why newborn screening is so important for young children with sickle cell.
And is it also important for people to obtain screening as adults as well?
That is a great question. Now, if you were born in the United States, since newborn screening was instituted, then you've been screened. And if you immigrate and where you may not have had access to universal screening, it might be worth getting tested. Now, what's interesting is that sickle cell disease tends not to be subtle, right? So it's unlikely to go unnoticed into adulthood. However, what I think a lot more people have sickle cell trait than actually have the disease. And then what's interesting is that sickle cell can be co-inherited with other disorders affecting the blood. So, for example, other thalassemias. And so sometimes people have sickle cell and they've also inherited a different kind of red blood cell disorder such that it kind of changes the effects of their sickle cell. And they may not have a severe sickle cell. So I think that it's important to talk with your doctor, especially if there's any concern that you might have sickle cell, And because it's, if you ever are going to get genetic testing, I always recommend talking to a genetic counselor, because the implications of discovering a genetic disease are significant, not just for you, but also for your family, for family planning, those kinds of things. So yes, do I recommend screening for those who didn't have newborn screening? Yes. And I would talk to your primary care doctor and or a geneticist before moving forward with that screening.
Thank you very much. So I think one of the reasons why I asked that question as far as adults are concerned is because I am originally from the Democratic Republic of the Congo, and it's very common. In fact, even when I wanted to get married, it was encouraged for us to actually get screened so that and the gist is like to kind of prevent if two of us or both of us maybe had the trait, to prevent or kind of like reevaluate what we wanted to do because of what could happen with us getting children. Would you talk a little bit about this?
Thank you so much for bringing that up. That's one of the reasons genetic counseling is so important, because as you know, it is genetically inherited. And so when two people come together who have sickle cell trait, then there is at least a 1 in 4 chance that one of the children will have sickle cell disease. And this is really important to have conversations with genetic counselors or even with your gynecologist when you're undergoing preconception counseling to say, hey, these are the chances. What can you do? We are living in an age where medicine has advanced so significantly that there are strategies to allow people to have children together and make sure that they don't end up with a child who has sickle cell disease. Very elaborate. And I mean, I'm in thinking of even people choosing the embryos that they're going to implant that don't have sickle cell. So it can be very elaborate and not cheap, expensive. And so historically, people have just said, you have trait, I have trait, we are not getting together. And I think human beings being who they are, I think what's really important is to have conversations with your providers, with your genetic counselor, so that you can be strategic. I think it is preventable to the extent that we know who is at risk. And so definitely it is important, because sickle cell, it's a debilitating disorder, and it's to the extent to which we can prevent children from having it or prevent conception. That just sounds a little bit weird, but just saying that having the right conversations around what's important in making sure that we're responsible as we're bringing in children into the world.
Right. So you mentioned that it can be very debilitating. Would you paint that picture a little bit for someone? What is life like for someone who actually does suffer from sickle cell anemia?
That is a really great question. One of the things that's so important is to recognize that pain is such a big part of sickle cell disease, again, because of the death of the tissues, as there's no oxygen going to them whenever there's a crisis. And so it's the pain of what we call infarction, the pain of tissue dying. And so it's pretty intense pain. I don't have sickle cell. When I listen to my patients and they describe the pain, it is intense pain. Sometimes they experience pain in the bones as well, which is really significant. But pain in really all parts of the body. Many times people will experience pain in their legs, in their back, in their arms, but really the pain can exist anywhere. So yes, one of the most important hallmarks is pain. A second one, though, as I talked about, is infection at an early age. And now I will tell you that historically, we called sickle cell a pediatric disease, meaning children died with sickle cell and they never made it to adulthood. And one of the biggest interventions was really identifying and preventing infection, right? Once we identified the importance of infection in an early death, then preventing infection through pneumococcal vaccination and prophylaxis, then children have been able to make it to adulthood. So the infection is really, really important. The other thing is just all the consequences of damage to the organs. So damage to the lungs, sometimes people present with what we call acute chest. That's a sickle cell crisis involving the lungs. Sickle cell
Uh-huh.
crises can involve the brain, and people can get strokes related to that. And so
Wow.
sometimes some of the strategies we use are to try to prevent stroke through transfusion therapy, limiting
Uh-huh.
the number of sickle cells available to get stuck in the brain circulation. And
I
then
see.
there are other things like damage to the bones. And so sometimes people will need joint replacements because they have bone damage as well. So there are a number of side effects and complications of sickle cell disease. And I don't necessarily want to go into all the details, but just really to say that it's pain, and then there's organ dysfunction associated with it as well.
I see. I was really young. I was in elementary school when I would see my aunt, suffering from these crises. And my mom being a nurse, she often, was told, from the doctor, of was provided folic acid. Why folic acid? It was always folic acid. I kept hearing folic acid. Why is that important?
Thank you for asking that. Yeah. So whenever you have what we call a hemolytic disease, that's anything that breaks apart the red blood cells. So sickle cell anemia is one of those diseases that breaks red blood cells apart. It's not the only one. Thalassemia is one of those as well. We want folic acid to be repleted, because whenever the red cells break apart, they kind of lose folate, and folic acid is really important in building up red blood cells. And
Okay.
so you supplement with folic acid to give the red blood cells maximum capacity of rebuilding. And so, yes, folic acid is really, really important for that reason.
Thank you. Thank you for answering, because I was always wondering folic acid. I knew about folic acid, but I didn't really know why. So yes, as far as the status, or the state of the disease is being very debilitating. I remember talking about my aunt, so personal, but I mean, she never really went to school, and that was back home in Kinshasa, in Congo. So she started in elementary school, but she had so many crises that eventually she didn't go to school. So and she was really smart, so she still learned how to read and write, but she ended up like learning how to do hair and things like that. But it really affected her in that way. And I remember also that she ended up being in a relationship, but once the man found out that she had sickle cell anemia, he kind of like left without even saying goodbye or having a discussion. So I think that it's very important, as you say, to do those screening, as a child. It's important, because then, as far as you're saying that, there was ways to be provided some medications to kind of alleviate everything. And also the fact that you said that even someone can actually even get pregnant safely. That's encouraging, because again, I have a cousin who married a lady that had sickle cell anemia. I believe they have two children now, but like it was I mean, her life was almost on the line. And again, that's also in Congo. I think maybe things are different here. But yeah, it can be very difficult. So, yeah.
Yeah, I will say that that the one of the things that's important to recognize is that sickle cell disease can present differently in different people. Some people have more severe forms
Cases.
of sickle cell, where they present with a lot of pain. They're in the hospital a lot. And some people
Yes.
actually have very few crises for the most part. And so it does depend on what kind of sickle cell people have. And even if they have the exact same thing, they can present differently. So yes, the support is needed. Having access to medications, having access to for people to stay hydrated and to have the
Hydrated.
pain be managed is so important. And what we haven't talked about yet is our treatments for sickle cell. And so I
Right.
suspect we're going to get to
That
that shortly.
That was I heard about bone marrow transplant. Could you please talk to me about this? I'm sure that's not the only treatment, but yes, could you talk to me about that? And then
Yeah.
if you could
So
expand a
let's
little bit
talk.
on more.
Yeah, so let's talk about the two main categories of treatment of sickle cell. Actually, I'll talk about three. The first
Okay.
group I'll talk about is supportive treatment, right? The
Uh-huh.
treatment that doesn't necessarily address sickle cell, but addresses all the kind of can support in terms of the complications. So hydration, right? Pain control, antibiotics to prevent infection. Those are all considered supportive therapies. They do not affect the disease. They just
Right.
support the complications that can come out of the disease. So that's one category, supportive therapies. The second category is a category that we'll call disease modifying therapies. And that means these are things that affect the course of the disease. One of the earliest drugs that has been available to treat sickle cell is called hydroxyurea. Hydroxyurea is a chemotherapy. It's an oral chemotherapy that's been around for a long time. And one of the
Okay.
things it does, we don't actually understand exactly how it works, but one of the things it does is it induces fetal hemoglobin. So fetal
Okay.
hemoglobin is pretty much the hemoglobin that very, very early babies, well, once
Right.
you're a baby lasting the first 6 months have, and that can be protective against some of the complications of sickle cell disease. So hydroxyurea was one of the earliest therapies. We have more therapies that have come up since then.
Okay.
One of them is called L-glutamine or Endari. Another one is crizolizumab. We also had one that was actually recently withdrawn from the market called Adakveo or
Okay.
Oxbryta. And so, kind of it feels like a little bit of a step backward when we have a therapy that then goes away. But these
Right.
therapies all impact sickle cell in one way or the other, either kind
I
of
see.
decreasing the number of pain crises that can happen, improving oxygenation and improving the blood count. So anemia occurs because the red cells are breaking down. And so, addressing all these aspects of sickle cell. So these are therapies that I would say are disease modifying therapies. The
Okay.
third class of therapies are what I would call potentially curative therapies. And I say potentially
Uh-huh.
curative because the guarantee of cure is not 100%. That's why they're potentially curative. The
Okay.
first, at least the older, is bone marrow transplant or stem cell transplant, as you talked about. And this is
Right.
where you're essentially turning giving the person a stem cell transplant, and you're turning them into sickle cell trait, so to speak, because they still have
Okay.
sickle cell,
Okay.
but now they also
Yes.
have red cells that they have normal red blood cells that are being produced that kind of dilute
Yes.
out the number of sickle cells that are produced. And it's
Right.
potentially curative because as long as the transplanted cells engraft and do well, then it is curative. But for some
Right.
people, unfortunately, the transplanted cells don't engraft and they
Right.
don't take a hold, and then it can be undone, and that's why it's potentially curative. But
I
yes, stem
see.
cell transplant is one of the older more curative therapies. More recently, in 2023, we had approval of 2 gene therapies, and we have many
Okay.
gene therapies that are actually still in clinical trials, still in the works. And these are therapies that work in one of 2 ways. One of the ways is by adding a gene or that allows the normal red cells to be produced. And the
Okay.
second strategy is by editing the gene to
Okay.
improve production of red cells. So
Okay.
both gene therapies, they're not similar to stem cell transplant, but the same kind of process the person will undergo. But what they're getting back, instead of a donor stem cells, they're getting their own stem cells that have been modified either through gene editing or gene addition. And so these are therapies that are pretty recent, approved in 2023, and are
Right.
still relatively new, but these are potentially curative therapies that do need to be that are important to explore. One thing I will say about these potentially curative therapies is that while they can, in essence, take away the effects of sickle cell disease, what they do not do is reverse the damage that has already occurred early on.
Gotcha. Oh, okay, okay. And how early can you actually start accessing those kind of therapies?
Wow, what a great question. Yeah, I would say that the supportive therapy is pretty much very, very early on, and those are going to be important long term. The disease modifying agents, hydroxyurea, is still
Yes.
recommended pretty much early on, even from as early as 6 months of
Okay.
life. Some of the other disease modifying therapies like crizanlizumab, and Dari, those are ones that you would talk to your, I would recommend that people talk to their primary providers. Actually, all therapies, you should be having conversations
Of
with your primary
course.
care doc and
Of
or your
course.
hematologist. But
Right.
yes, those are therapies that can be started early on. When it comes to stem cell transplant now, the thoughts are that the earlier you can get a curative therapy, a potentially curative therapy, then the better you are in terms of avoiding all the long-term consequences of sickle cell disease.
Okay.
That being said, everybody is an individual. Everybody has different impacts of sickle cell disease. So each person has to be considered individually. I think the question sometimes is this person having enough side effects of sickle cell disease that it's worth going through the whole process of these
Yes.
potentially curative therapies?
Right.
Or is the person having such a severe time with sickle cell that it absolutely makes sense? And how far is the organ damage? And to
Right.
what extent would we be expecting improvement with the therapy? So there's so many conversations to be had. I will say that with these potentially curative therapies, there's a commitment of months in the hospital,
Wow.
weeks to months. And so it's not a small undertaking. And that is why everybody should have a conversation with their doc about what's the best way to move forward for them.
Thank you so much. And we said how early, but what's the latest stage at which you can actually attempt those kind of therapies? Is there like
Wow.
an age that's, you're too old now, we just
That's
have
a
to
great
manage?
question. In the clinical trials, they tended to stay younger. So really, I think they transplanted or they use gene therapy on patients as old as in their 30s, which is not very old, but by sickle cell standards, it's older.
Yes.
Many of these therapies have not investigated older adults with sickle cell. So again, I would say that the general thought is the younger, the better, right?
Yeah,
You
all
want to
the
be
better.
old enough to be able to tolerate the treatment, but not too old
Yes.
that you've accumulated a lot of the side effects of sickle cell
And
disease.
damage.
But definitely, again, it's a case by case basis.
Thank you so much. I've been so enlightened. So there is hope, even for someone that does suffer, and especially if it's really being caught, the sooner it's being caught, like the better the outcome would be. But that being said, like when I say there is hope, is that it seems like also the lifespan has increased over the years with improvement of technology and medicine.
Absolutely. Yes. And I think that we've come a long way in sickle cell disease. We've got so much further to go. One thing that's always going to be important is the support of friends and family, the
Yes.
support of providers, people
Yes.
having access to the care that they need, access to the therapies that they need. So we've come a long way, and yet there's a long way to go still. But definitely there is hope, and sickle cell disease can be managed well and even potentially cured. So
Yes.
definitely, I think these are exciting times to help improve the care of people with sickle cell disease.
And so the way that somebody would approach once the screening is done, or if they suspect that the child might have sickle cell anemia, maybe because some other people, say for example in my mother's family, when they come to tell the stories that my grandparents did lose quite a few of their children, this is the one that we know about. So we assume perhaps they too had sickle cell anemia and they didn't quite make it. And mind you, that was like in the countryside, in the village, at the time, like in the 70s and all that. But what I wanted to say is that once somebody knows, the person should go and talk to the primary physician, who will now reach out to a hematologist, or can they go straight to a hematologist? And also, what kind of hospital should they look for? Any hospital can help them, or?
I would say definitely start with your pediatrician, because
Okay.
usually newborn screening results in when the baby is early. So parents are the ones who kind of carry the responsibility very early on. talk to your
Yes.
pediatrician. And your pediatrician should be able to connect you with a hematologist. I
Mm-hmm.
will say that there are many pediatricians who are caring for people with sickle cell disease who
Yes.
don't necessarily have access to hematologist support because there are
Okay.
not very many hematologists. And so I would say that the best care is the care you already have and partnering with that person to say, what other kind of care should I have? Definitely, it's beneficial to see a hematologist who specializes, that's a blood diseases doctor like me, who
Mm-hmm.
specializes in sickle cell disease. It's
Yes.
important to have that care.
Yes.
And, a lot of people who may not have access to a hematologist can still get great care with a savvy and well-informed pediatrician. And so that would be the starting point, is our pediatricians.
Let me ask you this, and you may not know the answer necessarily, but so I see that there's a lot of great advancement in the U.S., but is that so also in other continents, say like in Europe, in Africa, from what you know?
One of the things that's important to recognize about advancements is they have to start somewhere.
Yes.
And the most important barrier we cross first is
Mm-hmm.
that there's an advancement. And
Mm-hmm.
then once there's an advancement, then the question we can start to ask is, how do we now expand the advancement to others,
Mm-hmm.
especially where there are fewer resources available?
Right.
And so, yes, wherever there is a low resource setting,
Mm-hmm.
there is a general challenge in terms of access to care.
Right.
One of the therapies actually that we use in patients who have an acute crisis, for example, an acute stroke or
Yes.
acute chest related to sickle cell disease, is a therapy called red blood cell exchange. And that's just transfusion therapy where you're
Uh-huh.
able to give a lot of red cells at once while also taking away sickled cells. And so
Yes.
these are all therapies that are specialized, that need specialized nursing care, that are
Yes.
not always available, even in the United States, at many centers.
I
And
see.
so I think what's important is that these advancements exist,
Yes.
and we're continuing to work as a global community to get the advancement to where it is needed the most. Challenges exist, and we just need to continue to work to make sure that the advancements are available to as many people as need them as possible.
Thank you so much. This was so invaluable. I so appreciate you coming on our platform to enlighten our, audience about sickle cell anemia. As you say, as I said earlier, this is something that really at the core of my heart, in the center of my heart, I'll say, because we did experience that, and quite a few members of the family have. So I really thank you for coming on today and, enlighten me. I learned so much. There's so much that I didn't know, when we first started talking. And so I really appreciate you coming on.
It is my absolute pleasure to be here. Thank you for providing this platform where people can learn about sickle cell anemia. And it just has been a pleasure to talk with you. And thank you for having me.
Absolutely. But doctor, before we leave, if somebody wanted to hear more information from you, how can they find you, or where can they find you?
So the best place to find me is actually on LinkedIn. I am
Uh-huh.
always available on LinkedIn. And I also am on Instagram and Facebook, but less commonly. So LinkedIn would be the best place to find me.
And would your name be to me, Dr. Toyosi Onwuemene?
Toyosi Onwuemene, yes.
Wonderful. Thank you so much. And thank you everyone for listening in. I hope that you have learned as much as I have. And until we meet next time, you be blessed. Bye bye.
Bye-bye.